Today we are circling back to the topic of antibody identifications. We talked about single antibody identifications already, so we are going to be talking about multiple antibody identification today. If you are new, welcome to Blood Talks, and I hope you join our family by subscribing to my channel. Anyway, let's get going with today's topic. If you need to review single antibody identifications, you can find a link to it in the description box down below. I explain each step in detail. The antibody screen results for our patient is 330. I bet you already know what to do. We are going to follow the same exact steps as we previously discussed in the single antibody identification. Step 1. Write down the reactions on the correct antigram. It is a critical step. If you know the reasons, please tell me in the comments. I'll give you a hint. The answer is in a simple single antibody video. Step 2. Highlight row or rows with negative reaction. So, we will highlight cells number 3 in this example. This step may not be necessary once you become more familiar with it. It is just to make it easier for you to go through when you are crossing out. Step 3. Cross out homozygous cells. You may pause the video and come back to compare our results. Step 4. Double check and cross out the antigen at the top. As you can see, there are many antigens left, but don't worry, let's continue. Step 5. Perform antibody identification using panel cells. Here's the reactions for this panel. The reason that we do not start with the panel is that to maximize the resources of both patient samples and the reagent cells. If the patient has a negative antibody screen, then there's no reasons for us to do all this extra work. Using the results that we have here, now we are going to repeat step 1 to 4, just like what we just did in the screening cells. Step 1. Write down the reactions on the correct antigram. Step 2. Highlight all the cells with negative reactions. Step 3. Cross out homozygous cells. And just like before, you may pause if you want to finish crossing out on your own, then come back to compare our results, or just keep working together. As you are crossing out, have you noticed anything differently about the results of this panel? The reactions do not have the same strength. You have reactions of 2+ and the other have reactions of 4+. This is an indicator that these patients may have multiple antibodies. Step 4. Double check and cross out the antigens at the top. After crossing out, you will see that you have big D, big C, big E, CW, big K, KPA, JSA, and Lutheran A are left. Okay, now that you have done the panel cells, we have more information and patterns to look at. We can do some educational guess to rule out antigens. We can rule out KPA. Does anyone know the reasons that we can rule out these antigens? Now that we rule out most of the antigens as possible cause, we are left with only D, big C, big E, CW, big K, JSA, and Lutheran A antigen. As I'm looking at the patterns, the possible antigens here are D and big C antigens. However, we still have to prove our theory by ruling out all the other antigens by using Selective cell methods. Step 6. Selective cell panel. This is as needed. Selective cell panel is when we do not use the whole panel to do the test, but instead we only select certain cells from the panel that would help us in identifying the antibody. I select cell 5 because big C is positive and all the other antigens of interest are negative. Next, I selected cell 8 because we can potentially rule out big E, CW, big K, and Lutheran A antigen. As possible antibodies present in the patient plasma, this is a supercell. I'm also selecting cells 14 because anti-D is positive and the big C is negative. Normally, I would select more cells to rule out each antigen, but I have a pretty good idea of which antigens I'm looking at based on the pattern from antibody panel. Also, if cells number 8 turn out to be positive, I can come back and look for more cells focusing on big E, CW, big K, JSA, and Lutheran A. Here are the reactions. Cell 5, 2+. Cell 8, 0. Cell 14, 4+. As you can guess, we are going to follow the same exact steps. Step 1. Write down the reactions on the correct angiogram. Step 2. Highlight all the rows with negative reactions. Step 3. Cross out homozygous cells. Step 4. Double-check and cross out the antigen at the top. Cell number 5 is positive because the big C antigen is present. Cell number 8 is negative, so we can rule out big E, CW, big K, and Lutheran A antigen. Cell number 14 is positive because the big D antigen is present. Now you have it. This patient has antibody D and big C present in the plasma. If you make it to the end, give yourself a round of applause. You did it. Thank you for staying with me until the end. What do you want to know next? Do you want to know more about blood bank, chemistry, microbiology? If you have any burning questions, please feel free to leave me a comment down below. Lastly, if you have not done so, please like, share, subscribe, and click the notification bell. I will see you in the next episode of Blood Talks. And as always, remember, your blood tells you the story of your health. Thanks for watching. Bye!